these codes, these new codes, these are the new codes. Okay, so these 17 new codes, these are based on the normal type of ENM. Like it can be calculated based on the MDM or total time. Okay, so there is a difference in the description of the code. Like I'll just read through it. Synchronous audio video visit for the evaluation and management of a new patient, which requires a medically appropriate history and or examination, and straightforward MDM making. Okay, and here when using the total time, we need 15 minutes. Okay, so that I've already mentioned in the table. So all these codes, audio video visit for new patient. Okay, and here MDM should be low. Okay, or otherwise we can, if we are considering the time, total time should be 30 minutes. And then 98002. This is for a new patient, and if the medical MDM, okay, MDM part is moderate, we can go with this code, or else if you are considering the time, we can go with this 45 minutes. Okay. And the next is for, so this one also is for new patient. Okay, when the MDM is high, okay, high MDM, or else while selecting the code based on time, we can, that means the time should meet 60 minutes. Okay. Okay, actually it should meet, and the time should exceed. It should be 60 or more. Okay, in order to assign the these codes. And so this one was for new and established. Okay, so in established patient you can see 980042, 98007. Okay, so these codes are also based on MDM. For straightforward, we can assign 98004, and while considering time, 10 minutes. Okay, and if the MDM is low, go for 98005, and total time is 20 minutes. And 98006, for that the MDM required is moderate, or while considering time, 30 minutes would be met. And next is for high MDM, we need to assign 98007, and the total time considered should be 40 minutes. So either one is enough. Like if MDM is high, okay, we can go with 98007, or we can consider the total time. Okay, that is the usual ENM rules. Okay, so we can go with those codes. And okay, so audio video visit, those were the codes. Now we have audio only visit. Okay, so from here, okay, synchronous audio only visit for evaluation and management of a new patient, which requires a medically appropriate history and examination, and the MDM will be straightforward. Okay, so for this audio only visit, we have one more criteria. That means a time of 10 minutes should be there. Okay, it's not this separate time. Okay, along with the MDM, along with straightforward MDM, a minimum time of 10 minutes should be there to consider this particular level. Okay, so either we can go with this criteria, or we can follow the total time, that is 15 minutes can be considered. Okay, so for this one, there is an means these audio only visits, these have some exception, like 10 these minimum time as well as MDM should be met. Okay, so that is the new patient code for audio only visit 98008, and the MDM is straightforward. Okay. Okay, here you can see. Then the next code. Okay, I'll go with the PowerPoint itself. Here you can see 98009. Here the MDM should be low, okay, low MDM, and time of 10 minutes. This is the minimum time required. So both these should be there, okay, low MDM. In order to meet this 98009, MDM should be low as well as the minimum time of 10 minutes should be met, okay. So either that criteria we can use, or otherwise we can go with this one. If the total 30 minutes is there, we can assign the code. Okay, same is with the next range of code, the set of codes. 98010 is also the same thing, moderate MDM and 10 minutes of medical decision. And when using total time, we can go with 45 minutes. Okay, 45 minutes must be met or exceeded. So these two timings are different. Means the documentation should be, if suppose for a document, if for a chart, the total time is not documented. Okay, so for these new codes, we won't be able to assign a code if this minimum 10 minutes is not met. So we need to send a provider query. Okay, and then after getting the response, we might be able to code. Okay, so this minimum time also should be met. And next is 98011, where the MDM will be high and the minimum time of 10 minutes is required. Okay, so for all these codes, as you can see, the minimum time required is 10 minutes. Okay, it's not this total time I'm mentioning about. This time which needs to be there along with the MDM, that should be 10 minutes for all these. You can see. Okay, for audio only visits for the new and as well as established. For the new only, you need 10 minutes. Okay, here also you can see for 98010, the MDM is moderate. Okay, and the minimum time of 10 minutes is required, or otherwise, while considering time, in order to select the code, we need 45 minutes. Total time 45 minutes is required. Okay, so and then audio only visit for a new patient, high MDM. Okay, a minimum time of 10 minutes is required, and while considering time, 60 minutes is required. Then okay, for established patient, here also we need a minimum 10 minutes of time, and this one for straightforward MDM, we need 10 minutes. Okay, so for all these, the minimum time is 10 minutes, as you can see. Okay, and here 98012, 013, all these are based on MDM, straightforward, low, moderate, and high. Okay, accordingly, and then the time duration is this one. Okay, the minimum time required is this one, 10 for 98012, 20 minutes is required for 98013. It's not the minimum time, actually the while considering time as a factor to calculate the ENM, we can consider these time durations. Okay, so these were the some of the new ENM codes, and the other one code is this one, synchronous. Okay, so as I told you, these above these codes, these codes will be replacing this particular 994412 99443 range of codes. Okay, from starting from January 1, 2025. Okay, and this new code 98016. Okay, so actually we have this this code is not there. Okay, this code is not there, but instead of that, we have been using as of now we are using this G2012. Okay, so this will be replaced. Okay, this code will be replaced, and the new code code description as of this one. Okay, the code description is same, and the criteria which needs to be followed for the assigning this code is it should be virtual. It should be a virtual visit. Okay. As you can see, it should be a virtual check-in. And then it should be an established patient. Okay. It should be an established patient. Then the condition, it should not be originated from a previous encounter. Okay, it should not have been arised from a previous encounter. And then you can see there shouldn't be any previous encounter within the previous 7 days. There shouldn't have been any encounter. Okay, for that particular related type of diagnosis. Okay, for that related condition, there should not have been a previous diagnosis within the 7 days. Okay, and next criteria is that visit, this particular visit, okay, it should not lead to an ENM or procedure within the next 24 hours. That is, there should not be a follow-up for this condition within the next 24 hours. Okay, so there are these type of criteria to be followed in order to assign these codes. And also this 5 to 10 minutes of MDM. This is also one criteria. Okay, 5 to 10 minutes of medical discussion should be there. And as you told, it will be replacing this particular G2012, this code. Okay, so these were the new codes. Now we can come to the codes which have been, there are slight changes in the code description. Okay, actually these codes, 98960 series, 98960 to all these 98 until here, all these codes. Okay, I'll tell from here. These 98960, these all have been there. There is only a slight variation in the description. Okay. So basically, all the factors which is needed to be considered in order to assign this code remains the same. Okay, there is only a slight difference in this part. Okay, it has been just moved here and there. That's all. Okay, so education and training. So the purpose of this code is actually it is in order to teach the patient. Okay, for a chronically ill patient. Okay, the patient will be taught how to self-manage the condition. Okay, how to self-manage the particular illness. Okay, so it might be for that that education or training will be given either to the patient or to the caregiver or family, and the minimum time. Okay, here you can see. Okay, the each 30 minutes. Okay, for individual patient. If it is for a single patient, this code can be assigned, and the same description goes with this CPT. The change is that this is for 2 to 4 patients. Okay, when 2 to 4 patients are involved, we can assign this code. And for while assigning this 98962, it is for 5 to 8 patients. The time all is the same. Okay, this is for 5 to 8 patients. It can be for the patient alone, or it can include the caregiver and family member. Okay, and then these codes 98966 to 98968. Okay, so these were already we have been already using this code 98966. Okay. So for this also we need to follow certain criteria, like it should not be billed the same condition for which the patient is encountering for this particular visit. No, that diagnosis that the patient shouldn't have a previous encounter within the 7 days for this same condition. Okay, and also within 24 hours. Okay, there should not be a follow-up related to the same condition. So these are the 2 criteria. 7 days, there should not be any visit within the previous 7 days, and also for the next 24 hours there should not be any follow-up. And here these are time-based codes. Okay, and one more thing, this is a code in order to assign for non-physician. Okay, it's a non-physician qualified healthcare code. It's not for physicians, it is for non-physician personnel. Okay, and these three codes, 98966, 98967, 968, these three codes are time-based. Here it is 5 to 10 minutes of MDM. And here we have the same code description. The difference is that this is for 11 to 20 minutes of decision making, and this is for 21 to 30 minutes of MDM. Okay, and the next set of codes is for online digital assessment. Okay, from this one, 98970, 971, 972. Okay, these three codes are for online digital assessment. Okay, so there are some criteria, like it should be for an established patient. Okay, and same here up to 7 days. Okay, there should not be any particular visit. Okay, and no, sorry, like this code is applicable for the for a continuous of 7 days. Okay, and the total time, okay, taken in that particular 7-day period, that should be between this 11 to 20 minutes. Okay, so it's a time period of 7 days. It can be 3, it can be 2. So up to 7 days we can give this code. Okay, so this is also time based. If it is 11 to 20 minutes, you can assign this one. Okay, and for this one, if it is 21 or more, you can assign this code. Here all the other things are, all the other description is same. It is a non-physician qualified healthcare professional code. Okay, and it's for established patient up to 7 days, and then the time 21 or more minutes. Okay, and then these remote therapeutic monitoring. Okay, remote monitoring codes. So these are for therapy response. Okay, so all these are remote therapeutic codes. So and these codes, no, so these are based on the particular system based codes. Okay, our body system related codes. So this is the initial code in this range. Okay, so this is the initial setup code. 98975 is the initial setup code. Okay, and the next one you can see remote therapeutic monitoring. All these are the examples: therapeutic adherence, response, digital intervention. Okay, so actually trained clinical staff will be there in order to evaluate the patient's means the status. Okay, so like they will be a device will be monitored. A device will be used to monitor. Okay, so for this one, as you can see, it will be a respiratory system related supply. Okay, and here for this one, this code, it will be musculoskeletal system related. Okay, and for each 30 days. Okay, so in a date range of 30 days only we can assign these codes. Okay, once in 30 days we can assign this range of codes. And as I told you, these codes will be deleted in 2025. So this was ENM related additions, deletions, and changes. Then the next is the radiology. So this radiology codes, actually these are some safety related codes. Okay, like in patients where these MRI, okay, MRI is being performed, actually like this in the cardioverter defibrillators, okay, pacemakers and all. Before before actually an MRI is performed, okay, the main concern before performing an MRI is that these implanted devices, these these pacemaker or defibrillator, whichever it is, these should not be affected because of that MRI. Okay, while performing the MRI, it shouldn't affect the patient. Okay, patient's health or in any way, it should not affect, because this MRI involves magnetic field and this radio frequency and all. Okay, so because of that, it might lead to the image, the image we receive from MRI, there might be changes. It might cause changes, and not only that, if it is not, the parameters and all, if those are not adjusted properly, it can even lead to death of the patient. Okay, so that's why these are some of the safety related MRI, safety related CPTs. Okay. So starting from 76014. Okay. Okay, so these are performed by trained clinical staff. Okay, these means these services are performed by trained clinical staff. Okay, what they do is they actually evaluate a patient's implant. Okay, if the patient he or she has an implant in his body, that will be evaluated. And so how is it evaluated? Means it based on the previous medical records and all, they will be evaluating the patient's implant and the patient's total condition. Okay, and this code, as you see, all these reports, based on these reports, surgical report, imaging reports, okay, and review of previous imaging and all, the condition and the status of the patient will be analyzed. So, and it should include a written report, and this code can be reported for the initial 15 minutes. Okay, so initial 15 minutes, and this one is an add-on code. Okay, 76015 is an add-on code for this. If the same criteria, the same parameters, okay, is being performed, and but the time is there is an additional 30 minutes of time. Okay, so 76015 should be assigned along with 76014. Okay, so these are the first set of code. So this one is the initial, and this is the add-on code for that. Then next is 76016, 76017. Okay, so actually these codes, it is not used on a daily basis, and for all patients these codes need not be assigned. These codes are assigned for a patient with a particular device, okay, or a foreign body, like there might be some fragments of foreign body, like some fragments related to previous fitting or adjustment devices. Okay, so if those type of fragments are remaining, this magnetic imaging and all will be affected. So that's why these codes have been assigned. Okay, so these are a new set of codes which have been implemented. And what in the scenario, what the physician does is he reviews the patient's clinical scenario and all, okay, and all the diagnostic information, everything is analyzed, okay, and also the physician engages himself on advising the potential risk and actually the risk as well as the benefits of performing the MRI. Everything will be explained to the patient. You can see analysis of risk versus clinical benefit. All this will be explained to the patient. Then the clinical conditions will be addressed. Okay, and by analyzing the patient's condition, okay, they will decide which type of MRI can be performed. Okay, and also a written report will be there. Okay, so for all these, when all these parameters have been checked, this 76016 can be assigned. And then this 76017. Okay, so certain implanted devices. Okay, so these have certain adverse effect while this MRI or when this radio frequency energy is used on a patient. These devices may be affected adversely. Okay, so an MR safety expert. Okay, so MR safety expert. He will customize that particular MRI exam. Okay, that exam, no, that he might change the parameters. Okay, he will customize the particular MRI. Okay, that exam. He might change certain requirements and all, so that it won't affect the patient's condition and that patient's implant. It won't be affected. In such a way, he needs to change the parameters of the MRI. Okay, so that's what he will be doing. So in order to for that one, for all these, you can assign this 76017. So these codes are assigned for the technician. Okay, it's not a physician based code. It's for the technician or the physicist or MR safety expert. Okay, and then next one is 76018. So here, for in some instances, that the device that, for example, the pacemaker, etc., it has to be reprogrammed. Okay, so that it is not affected. Okay, it won't affect the patient in such a way. If it is a pacemaker, it should be reprogrammed. And if it is an ICD, that there will be the detection. There will be a detection probe and all. So those should be adjusted in such a way that it doesn't affect the implanted device as well as the patient. So this is for that programming and this is the main thing, the programming of the device. Okay. So these changes. Then 76019. This one. It is actually this purpose is same. Okay, the purpose is same, like the safety of the patient as well as the implant. Okay, the implant should not be affected. For that, while assigning this code, what they do is either they change the position of that particular means device, okay, or otherwise they will immobilize or adjust the working, okay, of that implant. Okay, so that's what they do when we are assigning this code. Okay, including application of protectors. Then these all parameters will be adjusted. Okay, so these are actually radiology based codes, but these are actually MR safety codes. Okay, these 6 codes are they have been implemented in order to maintain the safety of the patient. Okay, the services which is performed in order to maintain the safety of a patient while MRI is being performed. Okay, so these are the new 6 codes in radiology. Okay, so that's all in ENM and radiology section. So that's all, team. Thank you.
Thank you.
Thank you. Thank you, Martha, for the presentation. Thank you.